Heart attack, mini stroke. What is a mini stroke? A mini stroke, or transient ischemic attack, is a temporary blockage of blood flow to the brain, preventing oxygen from being delivered as it should be. This could be due to a blocked blood vessel at the brain itself or a blockage in the neck, such as within the carotid artery. Many people are unaware they have a health issue until a mini stroke even happens. Is a mini stroke the same as a heart attack? Both result from a lack of blood flow to critical body parts. A stroke is caused by a blockage in blood flow to the brain, while a heart attack is caused by a blockage in blood flow to the ear. What are the signs? 1. Sudden severe headache. 2. Sudden loss of or blurred vision in one or both eyes. 3. Trouble walking, talking or understanding. 4. Difficulty swallowing. 5. Weakness, tingling or numbness, typically in one side of the body. 6. Confusion. In order to recognize a mini stroke, it's important to know the potential signs and symptoms. If you or someone you know has experienced any of the following, even if the issue is resolved on their own, it is important to seek medical assistance immediately. Think fast. The National Stroke Association's acronym FAST can help you quickly determine whether someone is having a stroke. F. Face. Ask the person to smile. Does one side of his or her face droop? A. ARMS. Ask the person to raise both arms. Does one arm drift downward? S. Speech. Ask for a simple phrase, such as, "You can't teach an old dog new tricks," to be repeated. Is speech slurred or hard to understand? T. Time. If you observe any of these signs, call 911 immediately. How do you feel after a mini stroke? Feelings of fatigue and tiredness could last for some while afterwards, which could make life more difficult to cope with. Some people said that they felt lacking in confidence for some while afterwards, and some were nervous about being left alone or going out alone. What is the treatment after a mini stroke? Your doctor may recommend prescription medications such as antihypertensives, cholesterol-reducing drugs or blood thinners, or an over-the-counter aspirin regimen. There are also cases where medical intervention is necessary in order to restore healthy blood flow to the brain. What is the life expectancy after a mini stroke? At 1 year after hospitalization, 91.5% of DIA patients were still living, compared to 95% expected survival in the general population. At 5 years, survival of DIA patients was 13.2% lower than expected, 67.2% were still alive, compared to an expected survival of 77.4%. Keep your health.